breast cancer is the most common cancer among women in India. Compared to the world, we also have more women presenting in advanced stages of the disease and hence have a reduced survival rate also. The breast cancer is among the better known and more talked about cancers. Still, there are many misconceptions about the disease which need to be understood and taken care of. One common misconception is that breast cancer occurs only in middle and older age group. So while the incidence does increase with age, the diagnosis of breast cancer can occur at any age. And in India, almost 48% of women are diagnosed below 50 years of age. So it is important to be aware of the risk factors, early signs and symptoms, do regular self-examination and screening wherever possible. Another common myth is that if you have a breast lump, it means that you have a breast cancer. Now, most breast lumps are not actually cancerous. However, if you notice a new lump or a persistent one or any changes in your breast tissue, you should consult a doctor. Another myth number 3, that if you have a family history of breast cancer, you will surely develop it. Now, while if you have a family history, you are at a higher risk of the disease. But overall, if you see the total patients with breast cancer, only 10% actually have a family history. So if you have a first degree or a second degree relative or multiple generations diagnosed with breast cancer in your family, your doctor would probably advise genetic testing for you for breast cancer genes such as BRCA mutation. People often think that a breast injury or use of antideodorants can lead to breast cancer. There is no relation between a breast injury and breast cancer. Occasionally, we can have cases where a diagnosis of breast cancer was made subsequent to a breast injury just because the lump which was already present was noticed at that time. Similarly, there is no evidence to suggest a connection between use of underarm antiperspirant tubes and breast cancer. Another common misconception that has started coming up recently is that eating a lot of sugar can lead to breast and other cancers. So while eating too much of any food can lead to weight gain, obesity-related health issues, which can in turn increase your breast cancer risk because ultimately it is also associated with your lifestyle. However, there is no direct link between excess sugar and breast cancer. If you have a healthy diet and take sugar in moderation, mainly from natural sources, then you are not at an increased risk of breast cancer. So in a nutshell, we should remember to rid our mind of misconceptions and be aware and be responsible for our health and our life. And also, any time is the best time to discuss our health, especially if it's a woman's health. Thank you.